5 things sexually active people need to know about monkeypox. How is monkeypox spread during sex? Monkeypox can spread to anyone through close, personal, often skin-to-skin contact, including during sex. This includes oral, anal, and vaginal sex or touching the genitals or butt of a person with monkeypox, hugging, cuddling, massage, and kissing, touching fabrics and objects during sex that were used by a person with monkeypox and that have not been cleaned, such as bedding, towels, fetish gear, and sex toys. How can you lower the chance of getting monkeypox at places like raves, parties, clubs, and festivals? Consider how much close skin-to-skin contact is likely to occur at the event you plan to attend. Lower risk activities include festivals, events, and concerts where attendees are fully clothed and unlikely to share skin-to-skin contact. Be mindful of activities like kissing and sharing drinks that might spread monkeypox. Activities with some risk include raves, parties, or clubs where there is minimal clothing and direct skin-to-skin contact. Avoid any rashes or sores you see on others and consider minimizing skin-to-skin contact when possible. Settings where there is a higher likelihood of spreading monkeypox, including closed spaces such as backrooms, saunas, or sex club, where there is minimal or no clothing and where intimate sexual contact occurs. If you feel sick or have any rashes or sores, do not attend any gathering and see a healthcare provider. What are some ways you can prevent monkeypox? Talk to your partner about any recent illnesses and be aware of new or unexplained sores or rashes on your body or your partner's body, including the mouth, genitals, and butt. If you or your partner have recently been sick, currently feel sick, or have a new or unexplained rash or sores, do not touch the rash and see a healthcare provider. This is always a good plan. If your partner has monkeypox, the best way to protect yourself and others is to not have any kind of sex, including oral, anal, or vaginal sex. Do not kiss or touch each other's bodies while you're sick or share food or drinks. Be especially careful not to touch any rash or sores. Do not share things like towels, bedding, clothing, fetish gear, sex toys, and toothbrushes. How can you lower your risk during sex? If you or your partner have or think you might have monkeypox and you decide to have sex, consider the following ways to reduce the chance of spreading the virus. Have virtual sex with no in-person contact. Masturbate together at a distance without touching each other and without touching any rash or sores. Avoid kissing and sharing saliva. Consider having sex with your clothes on or covering areas where rash or sores are present, reducing as much skin-to-skin contact as possible. Remember to wash your hands with soap and water and disinfect fetish gear, sex toys, and any fabrics such as bedding, towels, clothing after having sex. Limit your number of partners to avoid opportunities for monkeypox to spread. What should you do if you have a new or unexplained rash, sores, or other symptoms? Avoid sex or being intimate with anyone until you have been checked out by a healthcare provider. If you don't have a provider or health insurance, visit a public health clinic near you. When you see a healthcare provider, remind them that monkeypox is circulating. Avoid gatherings, especially if they involve close, personal skin-to-skin contact. Think about the people you have had close personal or sexual contact with during the last 21 days, including people you met through dating apps. You might be asked to share this information if you are confirmed to have monkeypox so that your partners can watch their health and seek care if they develop monkeypox symptoms.